Do you have any type of musculoskeletal pain that your doctor prescribed either opioids or a muscle relaxer for? If so, then this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths and also the owner of Life Care Chiropractic. And having been in practice for over 2 decades now, this particular study hits very close to home. Uh, in it, researchers looked over the course of about 11 years from 2005 to 2016. We know in the past few years we've become real sensitive to the use of opioids because they really, quite frankly, they suck at managing pain for the vast majority of people. And the number of opioids deaths, unless you've been hiding under a cave, has been a huge issue in this country. And as well as being a gateway to things like heroin use. When the insurance no longer pays for the opioids, we now need something cheaper. So researchers looked at muscle relaxer use. So think of things like baclofen, cyclobenzaprine, um, uh, uh, carbo. I'm blanking right now. There's a list, but some of the benzodiazepines also fall into that list. But researchers found that the number of prescriptions went double from 15 million to almost 31 million in the course of this period of time. Even more concerning, the continued use, so not only initial prescriptions, but then going back and getting refills, tripled over that time frame. So people weren't getting off of these, they were just continuing to use them. 67% of these prescriptions were co-written with opioids, which is a really bad mix because if you look at the potential for respiratory depression in seniors, the risk of falls, it all goes up when you start putting these drugs in combination. 22% of the prescriptions were in the age category 65 or up, so a pretty good chunk of these. In my years of practice, it has been very rare that I felt that a patient really needed muscle relaxers, where they had that true muscle spasm, where they could hardly move, they could sit still, but the second they moved anywhere, the pain was so excruciating that it would take them literally 20 minutes or a half hour just to get off of my table. Those situations are truly rare. And obviously my opinion as a chiropractor is biased, especially as a chiropractor that does soft tissue work. So working on the muscles, ligaments, tendons, stretching, doing that with adjusting. I've never really felt handicapped in not being able to use these drugs. And it's been very rare that I feel that these need to be used along with my treatment plan. But the thing to understand when we start dealing with chronic pain is that chronic pain is an entirely different entity, and there is no one drug, no one treatment, no one surgery that's going to be a miracle for you. For chronic pain, this is something that you have to be a player and a part in the recovery. That means movement, that means dietary changes, that means mindset changes, that means seeing a chiropractor who really understands chronic disease and addresses the muscles along with that. Yoga is, I always say that yoga is very bad for business. It's because it's very good for patients. I also find that when patients are doing yoga along with what we do, they seem to get even better benefits. So the bottom line is that while we've focused a lot on opioids and cutting back on the prescriptions, in the background we've seen an increase in muscle relaxer use and continued use, which is a big concern, especially as a chiropractor. It means that we are greatly mismanaging this pain. If we use medications on the front end, we completely lose control of managing the acute scenario and increasing the likelihood of that problem becoming chronic. And that's what I've always said. I feel that the vast majority of chronic problems in this country have to do with mismanagement of the acute scenario. As always, I will post a link to this particular reference in the comment section. And please like this video, share it with somebody who you think needs this message, and subscribe to the channel.